When I first interviewed Miss Kate Ngbodi and Miss Golda Micah, our focus was on the challenges that healthcare professionals faced in their battle against the coronavirus. I was fascinated by the information that they provided, but as I listened to them, I had several questions that were running through my mind. And perhaps the most important was, as these nurses and other healthcare professionals get busy taking care of us and keeping the rest of us alive and safe, who is taking care of them? So I asked them if they will be willing to spend more time with me to have another interview with them so that I could explore that very question. Here now is that interview, and watch and listen to what they said. Um, it is my pleasure once again to welcome Ms. Golda Micah and Ms. Kate Ngbodi. Both of them are nurses who practice here in the United States. This is not their first time. We actually had a discussion previously where they discussed the challenges of being nurses, healthcare professionals in our current world with everything that's happening with the coronavirus. So they are back at my request to talk about how they're dealing with this personally. So it is my pleasure really to welcome both of you back. And so how are you doing, first of all?
Doing okay.
Yeah.
All
So,
right.
Ms. Ngbodi, how are you doing?
I'm doing well. Doing well. Trying to take care of myself so I can take care of other people.
So I want you to look at what you have on the screen. It is an article from yesterday, actually, that talks about how healthcare workers are protecting themselves from exposure to the coronavirus. And one of the reasons for this article is actually because of what you both discussed when we first spoke. The fact that you really have to take care of yourselves now and you cannot wait for anyone to do that. But I remember in all those years that I worked as a psychotherapist in active clinical practice, it was always fascinating to me that many of the people that I would see, many of the women that I would see, were taking care of everyone else. And I would ask them the question, who is taking care of you? So I have begun to think about that myself. And in reading this article, I was thinking about the same question. Who is taking care of the healthcare professionals? So my question to you, and this should occupy all of our time together today, it is, since you're so busy taking care of everyone else, how are you taking care of yourselves and your families? Ms. Ngbodi, if you will go first to answer that question.
Taking care of myself, keeping clean, washing my hands, and washing myself, and doing everything that I can to keep my environment clean. Talk about things that have become like a standard in my home: bleach, Clorox wipes, wipes of any kind. I wipe the doors, I wipe the mailbox every day. And I encourage other people to do that. I wipe the doors, I clean anything, everything. As a matter of fact, we're using disposable fiberware, silverware, plates, disposable stuff. That's what we're using in our house at this point. Whenever I have gone to provide care, whenever I've gone to work, at the entrance, I begin to take off my clothes. Very interesting. Leave my coat and my shoes outside the house. Take off my clothes. Take a warm bath shower before. I mean, the towels are available for me as I come in. Everybody, I'm taking major steps, as well as making sure there's food in the house. So I have no reasons to run to stores. When it first started, I began to hear about the shortages all over, shortages of foods and amenities and things that are applicable to keeping homes. I began to make calls to my friends and families. Go, buy what you can to keep your families away from the streets and away from the markets, from the supermarkets. And I have also encouraged my family all over the world, as well as friends and colleagues of mine. Social distancing, even in the house, even in the home environment, has been extended for me and my family. Hand washing, major. Body washing, major. Keeping clean in every way that we can. So it's been a major awakening, and so I'm trying very hard. We're trying very hard, but it's a life that has changed and may have changed forever.
Wow. Miss Micah, I saw you really nodding in agreement a lot.
Just in addition, even in the car, I have wipes.
Mm-hmm.
I come in and I'm wiping the steering wheel that I just left. I'm wiping the seat that I just got up from to sit back on. I wipe. Wiping anything. Wearing masks, even indoors. Just, it is life-changing, but we're living it until the pandemic is over.
Miss Micah.
When I heard Auntie Kate said, I wash myself with, I almost ended for her, I wash myself with bleach every day. But my experience is not different from her experiences. It's basically the same. At the end of my work day, I park somewhere, and then I sterilize my whole car, the steering, everything that I touch that day. And as we speak currently, I have like big garbage bag, plastic bags over my car seats, that because I feel like, my clothes are almost dirty every day. I have that over the car seat, and sometimes I take it and I dispose of it and I wipe down the car seat. And when I enter my home, my washing machine is at the entrance, so I'm lucky to have that. So the first thing I do is I strip off my clothes and put them into the machine. In the morning when I'm leaving, I leave a towel in the dryer. So when I strip off everything into the machine, I start the machine, and then I pick up a towel from the dryer and I go upstairs with that towel straight into the bathroom to take a hot shower. When I'm done, I sanitize everything that I touched, and then I go to my room. And my room is currently out of bounds to the kids. This whole thing is very sad because the kids are home now and they need me, but they cannot have my full attention because I'm scared. I don't know what I brought home that day and I don't want to infect the kids. So I go into my room and I change into my clothes, and I change into clean clothes, and I come out with a mask on my face. And I come here to the dining area, to the kitchen to get my dinner, and I sit across the table with them like 6 feet apart, and we interact for about 20 minutes, and then I go back to my room. And then after that, everything else has to be said over the phone. If they need something, they have to call me on the phone, and then I have to tell them what to do. I don't come back. If I need to come out and come and talk to them again, I have the mask on before I come out. This is just what I'm doing to protect them from, because I have to go to work every day. And the most challenging part for me is because they are young kids, they still need me to cook for them. They still need me to help them with their homework and things like that. But how do I do this? I want to backtrack a little bit. I eat from, as Auntie Kate said, I eat from disposable utensils. I use disposable spoon, fork, plates, and so that I don't mix with them, so to say. So the most challenging part is we are being told to sleep early, do things to boost your immunity and this, but the sleep that we so need, we are not getting it. Because of all this infection control and things, it also takes a lot out of you. Your energy is depleted by the time you come back home. I'm smelling bleach, sometimes having headache from bleach all day, And so I have to wait for them to go to bed before I come out again. So after they go to bed around 10, 11, 12 sometimes, then I have to come out and prepare their next day meal for them and put it in the fridge, sanitize everything that I touch again, and I have the mask on, open the window, air the room, and there are no supplies, no spray to antibacterial or whatever spray to spray. So I air the room and do the best that I can. So it's very difficult. And much as I like to stay home, I can't stay home because I'm a nurse. And I'm the same person who is going to the supermarket after my work day to buy things that they need because they're home and they're teenagers. And I don't want them to go out. And the things that they do help me with, like when I come back, those days when I come back from the supermarket, I call them to take the things out from the car and put things away. I'm not allowing them to do that anymore because I don't want them to touch anything, and I don't know how they are washing their hands. Although I taught them how to wash their hands, I don't trust that they are washing their hands well. So whenever I go for grocery shopping, I have to bring all the things up, then make sure I wash everything in the sink very well before they put away in the refrigerator. So these are some of the things I'm doing extra just to protect the children and to protect everybody else. It's not an easy time to go through. It's very, very difficult, especially if you're not getting the rest that you need, and you know that if your immune is depleted, this thing can maybe, if you are exposed to it, this thing can get hold of you. It's very scary.
Somebody, I think you have something to say.
Yeah, I was just going to add that going back to our basics, there's something we call Deetle. Deetle, it's an antiseptic liquid.
Mm-hmm.
Some people are able to get that. So instead, it's something that some people are washing their bodies with, and I understand it could be very powerful, and I have also used it in this time period. And then also going back to taking off your clothes and everything, you just down them and put them in a paper bag, and I throw it to the basement to be there for days. That's another way of killing the germs.
Okay.
before they get washed. again, those are some of the things we learn in the basics of medicine and nursing.
Mm.
That could help anybody out there, but
Yeah.
this is the world we're living in now.
Yes.
Back to you, Dr. Ohiro.
Yeah, Ms. Ngbodi, you are a nurse practitioner with the ability to prescribe medication.
Yes.
How does it feel knowing at this time that we do not yet have medications that you can just prescribe to people to make this go away?
Very interesting question. Ironically, what some organizations have done is because they know that, again, come back to viruses. Viruses in general are not the same as regular microbes that can against which you can easily prescribe antibiotics. Microbes are different. They're not viruses are not regular microbes. I'll just put it that way. Viruses, a lot of times, all viruses fight. They are harder and harsher than regular microbes, for which I'm trying to use the layman's language. They're harder than the regular microorganisms. Viruses could be damaging, and that's why this pandemic is not a joke. You hardly see them. You hardly are able to recognize them. So for that reason, it has been very, very difficult to develop what can fight against coronavirus. So again, it comes down to what we're able to prescribe. A group of medications that we call NSAIDs, of which many people want to take for bodily aches, for it's going to serve as an antipyretic. These include ibuprofen and Motrin. Do not take them. They don't help at this time. So what are we trying to say? What I'm trying to say is that is where the self-isolation as well as the social distancing really, really comes to play. Stay away from other people because it can be transmitted by droplets, airborne, as well as contact. But viruses are hard to kill. They are hard, and that's why we're having the difficulty of being able to have anything that we can say, prescribe to fight the virus. It is a very, very rare one, a very rare kind. So that's why you have some organizations where they go test for flu. Then if a person is negative for flu, get them isolated. That is quarantined. Because that's the option that many, many, many organizations are using at this point. Only because of the shortage of testing kits, as well as the PPEs. They may not say this to patients, but that's the secret behind it. All right, test them for flu. If they have flu, we test them for flu, and they're positive for flu, we treat them for flu. If they are negative for flu, obviously, with the symptoms around them that they are presenting, we know that the way to fight the virus is to isolate them so they're not able to infect other people, and so they can be there and give them the other remedies that will not include NSAIDs, that may not include antibiotics.
Right.
And
Miss Micah,
help them.
I need you to do three things right now. And I am not going to get you lost in my question, but I just want you to do three things. One is to speak to me. And as you speak to me, you're going to be speaking to many people like me. I am by profession, by training, and profession indeed, a psychotherapist. in my job, in my profession, we deal with a lot of clinical issues, and people who come with significant diagnoses that are like depression and many of the others that you know. So as part of my work, one of the things that we try to do is to get people socially connected to minimize the social isolation, because social isolation, as we know from all significant research, can lead to increased depression and many other significant issues. But now we're talking about really not just social isolation or social distancing, we're talking about physical distancing, which is really a contradiction of the age-old practice of my profession, and in fact, much of psychiatry, for example. And I'm also the kind of person who, although I am quiet by nature, I like to associate with people. I hug, I hang out, I talk a lot in close quarters. Everything you're telling me to do is contrary to my nature. So I want you to tell me how to survive in these times. And people like me, how do we survive in these times? Miss Micah.
Well, I think you can do a few things. Like we are on Zoom right now. If you have friends, you can you can Zoom and see your friends, FaceTime and chat rooms and all that, all those things. Unfortunately, the hugging and things we have to cut right now, not by choice, but it has become necessary too, because we don't fully understand the mode of transmission. We say it's droplets and it's airborne and it's contact, and we are doing all those precautions right now to get rid of this pandemic. So it's a trying time for everybody, and we just have to bear with what CDC is recommending right now, and hopefully that by doing all this, taking heed of these recommendations and doing them, that we will minimize exposure and life will become as normal soon. It's a difficult time.
Right. You see, I told you that I wanted you to do 3 things, but I only said 1. The second one was going to be that I wanted you to assure me that life will get normal at some point, and you just did. But the third thing that I also want you to do is to speak to other healthcare professionals. Just say something to other healthcare professionals. What is your advice to them?
What I would like to say is, to you all, is that it's a difficult times, and our profession has mandated us to provide care to those who are dying and those who need us. And our oath, we also took an oath to do the most good. And so this is not a time to look back. All we need to do is to try to do our best in the circumstances. There are no PPEs, but whatever we have to use them and take care of the dying. We can leave them to die. We just have to do our best. It's very draining, it's very challenging, but with God, all things are possible. And whether you believe in God or not, I'm not trying to choke God down your throat, but at this time, I think that everybody needs to turn to something. So if you are a Christian and you believe in God, you believe in the strength of God to carry you through. And that's what I do. Every day that I live, I just commit myself in the hands of God, and not only committing myself in the hands of God, but also taking the needed precautions that I have to do. And with the help of God, we will get through this.
All right. Miss Ngbodi, I want you to do two things. One is to speak to other healthcare professionals the same way that the same question that I had asked Ms. Micah. And I like the fact that Ms. Micah gave us other ways to maintain our social connections, that we don't have to be physically in the same location, but we can still be socially connected. I like that. So what I like for you to do is to also say a few words to other healthcare professionals, but in addition to that, I want you to also think about the fact that Ms. Golda said, Ms. Micah and Golda said that this is going to, that normal times will come, which is very hopeful. To that extent, I'd like you to speak to people who are having a very difficult time now, complying with government regulations, especially in the parts of the world where we come from, where people really don't want to stay home. So can you also give them a word of hope? Like Ms. Micah gave us all a word of hope by saying times will become normal. So in addition to giving people back home some words of hope, could you also just say something to other healthcare professionals?
To the healthcare professionals, I say God bless you. I keep praying, I stay praying, and I continue to pray for my colleagues, my fellow healthcare professionals. I say thank you for all that you do, and may God bless you. I encourage you to stay safe. Use whatever equipments are available to you to prevent yourself from contracting and from being exposed. Stay safe. That is almost like the common saying now, even at the stores and everywhere. Everywhere. I don't go to the stores. I haven't been to any for quite a while. Well, you see people and they say to you, stay safe. Your patient's saying to you, hey, stay safe. So please stay safe. And then in coming back to maintaining the social distances, Ms. Micah already mentioned some things that we all can do, including you, Dr. Oni-Eseleh. And I encourage you to. And it's a good thing. Technology is very, very present now. FaceTime and all the such. Texting, cell phone use. Almost everybody has a cell phone. So, we're not as far as the world used to be we're not as far as various parts of the world used to be from each other. So I encourage communication with family and friends. This is a time when we still need each other. Don't go far from each other. Don't. Find ways to communicate. If you're not texting, make a phone call. If you're not making a phone call, just a regular phone call, use FaceTime. Send pictures, old pictures. I recently had a cartoon come to me on phone. Teachers and doctors, which one is more important? And some people chose teachers. And there were echoes of laughter about it. But this is a time that one is not more important than the other. But let us pray. Teachers teach people to become doctors. But when the teachers get sick, the doctors and the nurses take care of the sick. So everyone is important. But even the illiterate, we're all very important. Let's hold together. We're together in this. Pray for the doctors, pray for the nurses, pray for the healthcare workers. And again, I say God bless the healthcare workers, the teachers, the mental health workers, Dr. Ohiro and other people in your team. I say God bless you and thank you for all that you do.
We are at a time now when so many people do not believe that we're ever going to become normal again. But I think that part of that is that we are really not sure what normal means now, or what normal is going to look like when we become quote normal. And I don't think any of us here knows, but I think that when you talk about us becoming normal again, you're talking about a time when we're not going to be seeing so many people dying from this pandemic. That is very hopeful, and I thank you very much for that. Both of you know me well, and you know that when it comes to health, I'm actually a wimp. Therefore, when I am told don't go out because you're probably going to get a virus, I stay indoors. I'm not taking any chances. But you have spoken so much about your faith today. And much as I like to hear a lot more about that and how it keeps you going, I don't really want to go down that road. But what I would like to ask you instead is to validate my thinking about faith. I happen to believe in that for people who believe and for people who do not, there is no medication that works unless God makes it work. There is no doctor that succeeds unless God helps that to happen, which is one of the reasons why it is disturbing to me when people say, I'm not going to even take any precautions because God is going to take care of me. I know that Ms. Micah alluded to that previously when she said, I am a Christian. I believe that God will take care of everything, but I still take precautions. And then because God will take care of me, even through that. But can you just emphasize that one more time, Ms. Micah? In one sentence or two, so that everybody will hear that again.
Okay. What I said is that I believe in God. I have faith that God is going to see me through. And yet I take precaution. I take the needed precautions. I don't just go and see my patients without gloves, without the proper PPEs. I do take precautions and believe and have faith that God will see me through, and God is the ultimate cover over me as I see patients.
Thank you very much for emphasizing that. And so, Ms. Ngbodi, would you just say one word to support what Ms. Micah has said?
I'm a Bible-believing Christian, raised as one, and living as one. I'm a believer in God, and I believe His word. In James chapter 2, I think it's somewhere around verse 14 and downwards, faith without works is dead. You can't say you have faith and you don't work to apply the faith that you have. Then what are you having the faith in? We have if you have the equipment to support your faith, use it. You can say you have faith and you won't use the PPEs when they're available to you. That is you exposing yourself to those who are infected.
Right. So the point really is that regardless of what we think, a lot of scientists are Christians too. A lot of doctors, a lot of nurses, healthcare professionals are Christians too. And we are going to be fine. We just need to support one another and take the precautions, do everything that we are being asked to do so that we can be safe and healthy. Thank you very much, Ms. Micah. Thank you very much, Ms. Now that you have watched this interview, I would like you to do one thing, and that is to click the subscribe button and subscribe to my channel. In addition to that, please visit www.ruminationsblog.org and read my blog articles. And if you have just one more minute, please just Google Ruminations with Ohiro Oni-Eseleh, or visit Apple iTunes or Buzzsprouts, and in any one of those places that you go to. When you get there, just type Ruminations with Ohiro Oni-Eseleh and listen to my podcast. Thank you.